Okay, so just to get started, I only just figured out how to get onto here. So I would like this. This is a nice, reasonably small group so far. We'll see how it goes. I want to discuss here some of the work that we've been doing in my group in particular, and it's very applied work, and it builds on some of the work that a lot of the work that I've been doing over the past decade. So essentially, since for the last 10 years, I've been working with different kinds of data streams from mobile phones to understand human migration and mobility patterns in relation to the spread of infectious diseases. Specifically in the context of outbreaks and understanding the spatial spread of disease for forecasting purposes, as well as in the context of trying to understand how normal migration patterns create differential patterns of disease in different places for diseases like malaria and dengue. For this really unprecedented pandemic setting, at the beginning of an outbreak like this, in the absence of pharmaceutical interventions like vaccines, we really only have social distancing, which should really be called physical distancing, as a tool to control and reduce transmission of the coronavirus. So, as you all know, incredibly strict lockdowns, reductions in mobility patterns have occurred since the first lockdown in Wuhan, and then beyond in nearly every country where the virus has started to transmit. So this reduction in contact patterns, which is what we're trying to achieve with physical distancing interventions, is something that, because we've never done it on this widespread scale before, we still don't really know how to link the reductions in mobility patterns that we're seeing with contact rates that are relevant for the transmission of the virus. So at the moment, although we know that these lockdowns seem to have an impact on transmission, we don't really understand the mechanistic and even just empirical relationships between a particular change in behavior and the contact rates that result and lead to transmission and ultimately cases and deaths. So we have been pulling together a network of researchers across the US and internationally. And the idea is that we are going to be working, we're working with data providers that have mobile phone data that we can use to understand how physical distancing is actually impacting population level patterns. So we are working in particular with data providers like Facebook, and their Data for Good team, with a company called Canva Systems, which has ad tech data, for example. All of those data essentially take geographic or location-based service information from individual phones, and then they aggregate them up in time and space to avoid re-identification of individuals within the data set. And we can use that information in an aggregated sense to get a feel for how people are moving around, how people are moving between places, and how those dynamics are impacted by specific lockdown or other physical distancing interventions. So, for example, what is the impact of closing schools on overall mobility around a neighborhood and mobility patterns to other parts of the country? So we're seeing a range of different interventions put in place: school closures, workplace closures, cancellation of mass gatherings, travel restrictions. And in response, there is this mass impact on mobility that we can measure using mobile phone data. And the goal is to not only inform decision makers about whether the interventions and policies that they're putting in place are having the desired effect, but also ultimately to integrate this kind of information into models that can help us understand how to relax social distancing later on and to monitor it. So in the absence of having data with which to measure the response to a particular intervention, we won't be able to either monitor or calibrate the relaxation of physical distancing policies in the future in a way that's guided by evidence. So we've developed this group of researchers called the COVID-19 Mobility Data Network. We have a website, which Nishant, if you could put it into the chat box there, so that people can go and check it out. We will be hosting a couple of dashboards on a county level. So Facebook and Canberra Systems are both releasing their data on a county level for the whole US and in some cases internationally as well. But more importantly, what we're doing is we're working directly with particular partners at the city level and at the state level across the US, as well as internationally in India and the UK, and in multiple countries in South America, to tailor analyses beyond these aggregated measures to particular locations to try and help inform their social distancing policies, and then to help them make evidence-based decisions in the future as we come through the first wave of this epidemic and start to relax physical distancing efforts. I think the most difficult technical part of this is not just the aggregation itself and the type of data we're getting, which I will ask Nishant Kishore, who's a graduate student in my lab and has been working with this data. He's going to describe some of the data itself. But I think from a technical and policy relevance perspective, the most important aspect that we'll need to try to do in the coming weeks and months is to really understand the mechanistic underpinnings of the data that we can measure on the aggregate level, which is quite coarse-grained, and what that means for contact rates that go into our forecasting models, because that's going to determine how well we're able to link these data to how effective policies are going to be and how we think we're going to be able to monitor them in the future. So I should say that what we're not doing, there are two things that we're not doing that I think are easily mistaken for this. So we're not working on contact tracing apps that you may have read about. Those apps require a whole different set of technical decisions, as well as having a much more important privacy component and different legal ramifications. What we're doing here is looking at aggregated data sets that don't risk any kind of re-identification. The other thing that we're not doing is making forecasts about where we think the disease is going to go next. And one of the reasons for that is that many of the parameters associated with the epidemiology of this disease are still so uncertain that it's very hard to make forecasts until we have more data on some of the basic aspects of the disease. In particular, what fraction of people have no symptoms at all for the entire duration of the infection, and how many mild cases there are out there. In the absence of effective testing, and we've been extremely slow to test, and it's still patchy, we don't actually know how many cases there are. What we're going to have to do is start parameterizing our models based on COVID-19 deaths, unfortunately, because that's going to be the most accurate source of information with which to parameterize our models and link them to the mobility patterns that we're observing. So what I will do, if you have a question, since there aren't that many of us, if I have the participant list here, if you want to raise your hand and I can call on you. And then in the meantime, Nishant, would you please just talk through kind of what these data are and how we think through some of the aggregations? Just take 5 minutes or so to talk through that. That'd be great.
Sure. So I'll split up the discussion into two different sections from the primary data providers, which is from Facebook and then from Canberra Systems as well. So from Facebook, there are three specific data products, which are movement data, population data, and co-location data. The movement data give us vectors of transition from one location to another. And the locations here can be defined as Bing tiles, or they can be defined as specific admin areas that Facebook uses as well. Essentially, the way you want to think about it for Facebook is that they develop this bounding box, a geographic box basically across space. And as soon as they start their pipeline of data collection, they aggregate data from the previous 45 days as well to essentially act as a baseline. So for example, if you started data collection on March 1st, it'll use the previous month and a half's worth of data to establish what a baseline might look like. And then starting on March 1st, it'll start aggregating 8-hour chunks of time and giving you information such as how many people move between region A and region B during that 8-hour period of time, and also how many people moved between region A and region B on an average 8-hour period of time, conditioning on the same day of the week and time of day as well. The second type of data set from Facebook is the population data. So as you might imagine with movement, if individuals aren't moving, they don't generate data for Facebook for a variety of movement metrics. And so the population data gives you an idea of where people are. And again, it's in the same sort of aggregated to 8-hour blocks and gives you an idea of how many Facebook users are in a given region during a given chunk of time. And that's been useful as well when we don't see as much movement as we might during stay-at-home guidances. The final piece of data offered by Facebook is co-location, which they've written a bit about, but in very sort of general terms, gives you the probability of a random person in region A co-locating anywhere in the world with a random person from region B. So giving sort of a more direct metric of what contact might look like between two regions. And currently, for example, for the US, they've provided this for between every county as a very sort of large matrix. And for other countries as well, they're aggregating it to, I believe, admin 3 regions. So there are plenty of questions and specificity about the data that we can talk about if you have questions, but just sort of at a high level, that's kind of what we have. For Camber, for Canva, they're also aggregating these data currently at different levels and providing us measures such as transition, which is very similar to what Facebook is providing, but other measures which we can't get from Facebook, such as radius of gyration or average radius of gyration in a county, entropy. Again, these metrics give a better view of how many people are moving, how predictable is their movement, and other metrics such as the proportion of users in a given region who only stay in one region or only stay in one 600 meter by 600 meter tile. So again, a variety of different metrics that we're working to sort of aggregate and compare and be able to get different views of the same phenomena that we see on the back end.
Thank you, Nishant. So to add to this, so the approach that we're taking here is that, so you may have seen kind of mobility dashboards and mobility data in the press. The New York Times and Unicast have released some data. Having worked with this kind of data for a long time, there are quite important issues of representativeness and uncertainty that we believe are going to be very critical to communicate to policymakers before they take these kinds of publicly available dashboards and try and integrate them into their decision making. So the role that the network plays is really to provide a point of contact in the research community with somebody in government who can ask questions and explain uncertainty and bring together multiple sources of data, not just from one data provider. So obviously, both ad tech data and Facebook data come from people who have smartphones. So in low and middle income countries, that's often not representative at all of the general population. In those cases, mobile phone data more broadly, so telecom, so mobile operators collect what we call detail records, CDRs. That you can use a dumb phone, that can come from a smartphone or a dumb phone, and that's much more representative. In every case, when we're thinking about aggregating these kinds of data sets, it's really important to think through some of the technical aspects of uncertainty in the estimates that are being generated. And in particular, the representativeness, both in terms of the demographics. So of course, smartphone users exclude children and often elderly populations, but also they correspond to particular socioeconomic classes. So again, making sure that there's a kind of rigorous framework for quantifying uncertainty, thinking through representativeness, and then critically communicating that to decisions is something the network good job of. So supports for a number of states, and we're working with partners physical distancing interventions and policy. Case the sort of technical aspects of aggregation are not standard across these data sets. So there's still a lot of work to do, just kind of comparing different kinds of data, figuring out how to measure uncertainty effectively, and then communicate that in a way that makes sense for policymakers. You know, most, say, city level planners, so we're working with cities from Kansas City to Miami to Boston to LA, and you know, for them it's not necessarily useful to get a complicated radius of gyration estimate for a particular place. So we try to work with them to make sense of what that might mean in terms of their interventions. And I think that's going to be increasingly critical as we move into a phase where policymakers may want to relax some of their physical distancing interventions. So this network is led by myself, Sachit Balsari, who, if you heard from before, is affiliated with HSPH and the medical school as well. And then we're also working with Andrew Schroeder, who is at Direct Relief, an NGO that is in charge of delivering PPE and other medical supplies across the US and internationally. So I guess in general, you know, we believe that this kind of data is crucial, and not just in this pandemic, but actually more generally. We've been working with it in response to natural disasters, in the context of conflict. We want to be able to monitor mass mobility patterns that underlie some of the most important threats facing us as a world. And these data sets provide a way to do that if they're analyzed carefully and within the constraints of a robust and rigorous privacy framework. So I think that there's been some concern that that some of the analysis of data owned by private companies has not been done respecting the privacy frameworks that have been laid out. But in fact, there have been many years now of thinking through how these data should be aggregated in ways that protect people, and the ways in which we disseminate that information, on what granularity of scale and for what purpose. So there have been a number of frameworks laid out for how to do this in a way that's safe and ethical, and we continue to work on those. They're accelerating right now as many different actors are getting into this space, and a lot of the tech companies would like to help. The last thing I would say, and I don't see any hands up, so I don't know whether that's because we're so interesting or we're just really boring, but the last thing I would say is that there is an issue emerging, I think, during this pandemic, and we have seen the emergence of people without expertise in modeling taking on the role of modeling and forecasting, both in the corporate sector and in the public in general. And I think that there is an important role here for people that have technical expertise in trying to help filter and direct policy. Right now we're seeing many management consulting firms stepping in to support state and local government decision makers in the absence of technical expertise required to make sense of these very complex data sets in the context of epidemiological models. And I think that that is a risk, a big risk actually, and we need to really make sure that expertise, which is of course there's a bandwidth issue here, but I think that we need to make sure that there is some recognition of the fact that making models in the absence of expertise can be counterproductive in the context of a public health emergency. Okay. Oh, I see a question from Alyssa. Alyssa, do you want to ask the question in general?
Sure. I just with what you were just saying about people who are not experts, many of my astrophysicist colleagues are doing exactly what you're saying, and I'm very annoyed with them. So I just wanted to say that my group is happy to offer visualization and communication assistance. And so I had put something in the chat later that we can talk about
Yes.
that later if you want, because that is something where we have something to offer.
Yes, thank you. I appreciate that. And I think just today we've been running up against our visualization walls, shall we say? And I think that there was a really wonderful article by Julia Gogg in I think it was in Nature Physics about how people with quantitative skills can help, because they're, you know, I'm by no means I don't imply that there aren't ways that people who are physicists or data scientists can be helpful. And I think visualization and communication is one of the main ones.
There have even been articles in the visualization community telling people who are just doing visualization without collaborating with people like you to basically shut up. I'm leaving out a word that was "shut the blank up," was basically the title of the article. So anyway, so I wouldn't want to do that. But if any of your collaborators want to have some help, we're happy to help.
Thank you. I appreciate that, and we will follow up. And certainly, I mean, if you look across the analytical pipeline for all of this, even for what we're doing, so imagine that you're trying to coordinate a study where you want to estimate the impact of physical distancing on COVID cases in the next month. You know, the breadth of expertise that requires is actually very large, right? So first you have to understand what these company data sets mean, and you have to understand the uncertainty, how they're collected, some of the technical aspects of mobile phones, and then you have to understand how those aggregations could be linked to epidemiological models. But more than that, then you have to be able to understand all of the uncertainties associated with hospital data, the kinds of biases inherent in our testing capacity and system in a context-specific way. And then ultimately, in order to actually have impact, you also need to be connected with government and people making decisions, and be able to explain all the way along that analytical pipeline what's going on, which bits are most uncertain, and how they should be using that to inform policy. And keeping in mind all of the privacy and legal frameworks that go along with all these different types of data. So in fact, this has to be an interdisciplinary, highly collaborative type of approach. And I think one thing that we've seen with this outbreak is that we are hastily building those pipelines in short order, when it's taken years to try to push for even parts of the pipeline to get going. So my hope is that this crisis will ultimately lead to the recognition that we need these kinds of team efforts that can support and advise policymakers using the best data we have available in near real time. Right now, I think our educational structures for training people how to do different parts of this analytical pipeline are insufficient. We need new ways to generate a whole new sector of people who can understand the technical requirements and be in constant communication with governments and decision makers, even outside pandemics, to help them with their routine surveillance needs. You know, most of my work is on malaria, and even in the context of malaria, the requirements for routine surveillance systems are increasingly technical. We can incorporate parasite genomics, mobility and migration data, satellite information, all these different types of data layers. And the traditional surveillance systems, especially in low and middle income countries, don't have the capacity to absorb all of those new technical requirements. So my hope is that as we build out these pipelines quickly, both from the analytics side and from the visualization and communication side, they can go on to help us even after this pandemic crisis has passed. So that's kind of the short-term, medium-term, and long-term vision for what we're trying to build. It's hard to believe that it's only been a few weeks since this began. It seems like a lifetime. But yes, here we are. We're making progress, and I hope that we, at least the mobility data piece, should be starting to make a difference and really help us understand what's going on and what we should be doing down the road too. Let me know if you have questions. I see we have 24 participants. Oh, yes, we have a question from Akshay D. Do you want to just go ahead and unmute and ask your question?
Hi, Professor Bucky. Thank you to you and Nishant for this really interesting discussion. It's been really fascinating and I've learned a lot. So for myself, I guess I came to this online symposium just because I'm fairly early on in my career, and this type of like spatial forecasting of disease spread using mobility data is really fascinating. And it's like, I'm trying to figure out if it's like something I want to do in the long term. What kind of like analytical programming or statistical skills would you recommend investing in to be able to like do this kind of work in the long term?
I guess it sort of depends what stage of your education or career you're at, but I mean, I think in terms of this kind of dearth of expertise that we were just talking about, the biggest thing is that there is this very long history of infectious disease epidemiology modeling. And without understanding the conceptual framework of modeling itself, from basic SEIR models, starting with Comack and McKendrick, all the way through to more complex agent-based models. I think you really need a solid grounding in the fundamental theories that underpin infectious disease epidemiology. I think that's what's missing from many of the people who are in it from a data science world and they want to pivot. They haven't taken time to invest in reading the literature, the long history of literature on the conceptual underpinnings. And if you don't have that deep knowledge, then it's very easy to make misguided decisions about how to structure your model. Building models is sort of an art form because you have to decide which bits you can abstract away, which bits you absolutely need mechanistically. And as the world becomes more complicated and we have the computational power to elaborate infinitely complex models with agents doing all kinds of things, the temptation is to increase complexity without bearing in mind the reduction in transparency and reproducibility and ability to even comprehend your model results. And to do that in a sensible way requires a really deep understanding of the fundamentals of infectious disease epidemiology. The great thing is that now there are increasing numbers of courses online and available. Penn State has a great MOOC that you can do. Otto Bjornstad has released a wonderful textbook of epidemiology theory and models in R that you could download and do yourself. So there's a proliferation of tools to learn this stuff, but I think the key is not to skip the kind of theoretical foundational understanding of the subject, given the temptation to just go straight to coding up a complicated agent-based model. I don't know if that's helpful, but
yeah, thank you. What was the name of the second source that you mentioned?
I'll put it into the chat box here. The author is Otto Bjornstad. And it's something called like Epidemic Models in R or something like that. You should be able to find it online.
Okay, thank you, Professor.
Sure.
May I ask a question?
Please, yes.
Yeah, if I understand correctly, you're talking also about pipelines of continuous data integration, and how much of a boundary is computational feasibility for progress in this field? Because the data sets is. Yeah.
Say again, because the data sets are
huge. It's just a lot of information which is like constantly increasing, and for like exploiting this data, when do you think computational feasibility is a real boundary?
So in fact, I think that the the size of the data is not the important thing here. And this goes back to what I was just saying about the kind of foundational understanding of modeling. You can have all the data in the world, but if you don't know how many cases there are, if you don't have the basic epidemiological data, your model is useless. So I think that there's this temptation to substitute huge data sets for the small data sets that are actually key inappropriately. I think, yes, the mobile phone data that we work with and the data providers in general, they're dealing with enormous data sets. But once they kind of squish those down onto the temporal and spatial framework that you actually need to make your model, and your model, for example, might be on the order of a city, and case counts for a city, and so you need to have a time series or something from the data itself, and that time series isn't a high dimensional or huge data set. It just comes from a massive amount of information that's been crunched into the key metric that you're interested in. So again, understanding what the most important pieces of that large data set actually are can really take away a lot of the problems associated with the computation. That being said, I think the data providers themselves sometimes run into issues. We've had, for example, with baselines and things with the Facebook data. But from the actual modeling perspective and what you need to know, those aren't huge amounts of data. They're just the really important pieces from this huge cloud of information. And the pieces are often not to do with the kind of technological data itself. What we really need to know are things like how many people have asymptomatic infections, and what is the household structure in a particular place, and how are people, how do people behave when they go to the grocery store? What does that mean for contact rates? So those are kind of social epidemiological parameters. And often those are the ones that are going to end up being limiting, just because they're harder to measure and they're not available in vast quantities. So I think we've got 3 minutes to spare, so I think that's probably a good time to stop. If anyone would like to ask any more questions, feel free. Otherwise, thank you very much for joining, and stay home.